Chapter 5 of Goodman pathology is called Problems Affecting Multiple Systems. So the systemic effects on inflammation. So there's two types of inflammation. You have acute and chronic. And acute inflammation is whenever there are initial responses of tissue injury, specifically bacterial infections and necrosis involving vascular and cellular responses. So the local signs of inflammation include redness, warmth, swelling, pain, and loss of function. And then systemic effects, you have fever, tachycardia, and hypermetabolic state. The chronic inflammation is a result of persistent injury, so things that happen over a repeated amount of time. Basically, when acute inflammation adds up and now you have a bigger reaction, you have foreign body reactions and immune responses. So this is how the tissue responds to injuries. And basic things that you're going to see during the chronic inflammation stages are lymphocytes, plasma cells, macrophage, production of fibrosis tissues, and systemic effects include low-grade fever, malaise, weight loss, anemia, fatigue, leukocytosis, and lymphocytosis. Conditions that affect multiple systems. So there's a lot of conditions ranging from autoimmune disorders to shock, trauma, vasculitis, cancer, cystic fibrosis, congestive heart failures, connective tissue diseases, endocrine disorders, infections, malnutrition, and metabolic disorders. The systemic effects of neoplasm. So those include malignant tumors caused by destruction of healthy tissues, ulcers, compressions, and hemorrhages. So when healthy tissue breaks down, it becomes too compressed, it starts bleeding from hemorrhages and then ulcers. And gradual, rapid weight loss, muscular weakness, anorexia, anemia, and coagulation are also causes. The continued spread leads to bone erosion or liver, GI, pulmonary, or vascular obstruction. So adverse drug events. So there's a few different definitions. So adverse drug events, drug-drug interactions, drug-disease interactions, side effects, and dose-related effects. Adverse drug events is whenever you get things that you don't want to happen and that could potentially be harmful. And these are effects that happen because of the medications that you are prescribed and that you're on. Drug-drug interactions happen when meds don't act in the way that you want them to, and these add to the pharmacological effects that you would typically see from the drugs. Drug-disease interaction is when a medicine causes an existing disease to worsen. So you already have a disease and the medication's making it worse. Side effects are events that happen because of pharmacology or the drugs that we take, and they are very predictable. They happen within a certain amount of dose that a person is going to take for a certain situation. And dose-related effects include drug toxicity from overdose, variations in pharmaceutical prescriptions, pre-existing liver disease, presence of comorbidities. So the amount of dose that we take leads to different effects. So for adverse drug effects, we have non-dose drug-related effects. So these are things that happen because of something else that is going on in the body that's not related to the drugs that we are necessarily taking. Adverse drug events incidence. So little facts about that are that more than 700,000 cases happen in the emergency department and 120,000 hospitalizations. They are very common and 25% preventable. Adults older than 65 are 2 times as likely to go to the emergency department. Older adults 7 times more likely to experience an ADE requiring hospitalization than a younger person. And risk factors include age, gender, ethnicity, alcohol consumption, new drugs, number of drugs, dosages, duration of treatments, underlying conditions, and small stature. Adverse drug events / clinical manifestations include rashes, fever, jaundice, discoloration of skin, itching, burning, acne, and blisters. So for exercise and drugs. Exercise can cause dramatic changes in the way that drugs are absorbed, distributed, metabolized, and excreted in the body. For radiation injuries, we know that radiation therapy is treatment of disease by delivery of radiation to a particular area of the body. So, using this radiation to treat a certain area of your body. Effects to body tissues of exposure radiation. Exposure is linked to leukemia, thyroid, and breast cancers. Systems affected by radiation include the cardiovascular, lungs, or the respiratory, skin, in conditions like dermatitis, connective tissue, and then the nervous system. Pregnancy for radiation injuries, so the fetus can be sensitive to radiation. Exposure at 2 to 12 weeks causes growth in intellectual developmental disorders such as spina bifida, blindness, cleft palati, and clubfoot. Later development of cancer can also happen to children when the fetus is exposed to a source of radiation. So common cancers would be leukemia and thyroid. Post-radiation therapy, so you're going to want somebody to avoid taking alcohol, using certain lotions, gels, oils, and salves. Avoid lying on the area that the radiation was done to. Avoid exposure to direct sunlight, heat lamps, or other sources of heat, and avoid friction to tissue or radiation field. Radiation therapy and exercise. So radiation can cause a permanent scar formation in the lungs and heart. So you're going to have that damage from that specific radiation. And basically what you're going to want to do is you're going to monitor somebody's vitals, exertion rate, make sure that it doesn't exceed 15 to 17 for moderate intensity training or submax testing, and low to mod aerobic activity is done as appropriate. Here are some different classes of drugs. So you have NSAIDs, immunosuppressive agents, corticosteroids, glucocorticoids, and steroids. So the purpose of NSAIDs is to reduce inflammation. It's also for pain relief and decrease in fever. Its mechanism of action includes inhibiting production of prostaglandins from arachnoid by reversibly or irreversibly binding to COX. Adverse effects include GI bleeding, ulcers, perforation, myocardial infarctions, strokes. And risk factors include advanced age, higher doses, volume depletion, concurrent use of corticosteroids or anticoagulants, previous history of GI bleed or ulcer, or serious comorbidities. For immunosuppressive agents, their purpose is that they are used in organ and bone marrow transplantation. They're very toxic. Only serious, debilitating, and non-responding diseases should be the purpose of them. Mechanism of action includes corticosteroids used in maintenance of therapy, and the first line of agents in acute graft rejection. Calcineurin maintain immunosuppression, graft rejection to block T-cell activation, anti-proliferative, target the maintenance therapy and acute rejection, inhibit DNA synthesis and block T-cells from proliferation. Monoclonal antibodies target specific antigen graft rejection. Polyclonal antibodies are acute rejection. And adverse effects include transplant recipients, lymphoma, skin cancers, fungal bacteria infections, and risk factors include transplant recipients. So for corticosteroids, their purpose is to decrease inflammation and immunosuppression, mineral corticoids, adrenal insufficiencies, or type for renal tubular acidosis. Their mechanism of action is to bind to intercellular receptors which act to modulate gene transplantation in target tissues. Adverse effects include change in sleep and mood, GI irritation, hyperglycemia, bone loss, fluid retention, feeling nervous or jittery, mild anxiety/confusions, retardation, stretch marks, inhibits bone mineralizations. Risk factors include poor immune systems. The purpose of glucocorticoids is for anti-inflammatory and immunosuppressive properties. Mechanism of actions includes binds to intracellular receptors. Adverse effects include changes in sleep, mood, GI irritation, bone loss, fluid retention, jittery, anxiety, confusion, muscle weakness, atrophy, epiphyseal plate growth retardation, osteoporosis, avascular necrosis, and increase in vertebral fractures. Risk factors include poor immune system.